Made amazing plans to enjoy the time after giving the exams. Couldn't stop thinking about what all to do as soon as the exam gets over while preparing. But now that there's so much time, don't know what to do with it as well. If this sounds familiar to you, you're at the right place. So, welcome to medindian. In this video, we will try to find some ways to deal with this time. There are two ways to look at this. You'll never get such free time once you start residency. So, we'll enjoy whatever leisure we are getting right now and tick off all the boxes that we had on our bucket list. Or we use this time to learn all those medical or important non-medical life skills which we always wanted to but otherwise hardly found any time for. So here are some ways that we can spend this time. First, the obvious option of joining a job. For all those people who are tired of sitting at home and preparing since a year or are tired of waiting, this is a good time to get back to being a doctor and earn and also learn some hands-on skills. So head out to some of the hospitals near you with your documents. But the biggest catch is not many places have vacancies, especially in bigger cities, and they don't want people who are going to leave as soon as counseling starts. But if you do get that job, then why not? This is also a good idea for people who are still confused about which branch to take. It would be a good idea to work in the branches that you are confused about and probably shadow a doctor in the field so that you can take an informed decision as soon as counseling starts. But if you're thinking that you're anyway going to be working overtime in PG and are worried about the grind already and just want to Netflix right now or enjoy this time, here are some lesser known series related to medicine that you can see if you haven't already. First is Dr. Romantic. This is a Korean medical drama. It has 2 seasons. The title is kind of misleading. The romantic in the title is not referring to romance as such. The title refers to idealism, that is, what it means to be the best doctor in an unforgiving capitalist system. This is the story of a teacher who goes to a small hospital in a small village and how he teaches all the students under him. It's definitely one of the best medical dramas that I have seen, and it also has 8.7 rating on IMDb. You must check this out. Initially, even I was skeptical about watching K-dramas, but I just started watching them because a lot of my friends were super crazy about it. To be very frank, they are really nice. Second on the list is Hospital Playlist, another Korean drama with an IMDb rating of 8.8. It's a musical medical drama about 5 doctors who are friends since med school and still continue to be so years down the line. It's a light, flowy, heartwarming kind of series about how they start their own band and how they manage their hospital life as well. Next is Chicago Med. If you are someone who loves high intensity emergency medicine and surgery kind of action at the medical hospital, then you would love Chicago Med. At least the initial few seasons, which are good. If you like the ER, if you are an emergency medicine kind of a person, you will definitely like this. The next few are some of the more common ones, like Scrubs, if you are wanting a comedy drama about the life of an intern. Or you already know about Good Doctor and House MD. If you haven't already seen these, go ahead and watch them as well. If you are looking for more relatable content, something related to Indian medical scenario, you can always see Operation MBBS, which is available on YouTube. Both season 1 and season 2 are really good. Of course, you can binge watch all the non-medical stuff, all the movies and the series that were released during the preparation and that you never got the time to watch. If you're already done watching all of these, or you just want to have some quiet me time with you and your books or novels, you can check out one of these books, When Breath Becomes Air by Paul Kalanidhi, the perspective of a patient from a doctor himself. It's autobiography of a neurosurgeon who develops stage 4 lung cancer. So we as doctors often forget how the patient feels and this is a good perspective to have. Or you can check some of the self-help books about finance, growth, personality, psychology, mental health, or whatever suits you. If you're looking for something about finance, you can check Rich Dad, Poor Dad. The Monk Who Sold His Ferrari by Robin Sharma is also a good book about growth and personality, about life in general. Do let us know which other books or series we should check out. Next is to catch up on all the skills that are needed for life that we haven't had time to learn. One is cooking, especially with residency, very useful because you need to learn to cook and eat real quick if you don't have a hostel or a mess that is going to provide. Better than going hungry all the time. Next is to learn about saving, investing, and a bit of finance, like what to do with the stipend and things that are necessary for life. There are some recommendations about learning finance and investing. One is The Urban Fight on YouTube. It's called The Finance Talk. And the next one is Finance with Sharon on Instagram and also on YouTube. Ankur Variku, which you might have already heard about. Then CA Rachana Ranade's YouTube channel. Also B Kifaiti, one of the YouTube channels which are good, which tell us about in general finance, investing, money, and how to deal with it. Or you could consider getting back in shape after months of inactivity, like get fit so that you can run around from pillar to post throughout the hospital in the first year of residency. Please also let us know how to spend this time in other productive ways, will help us as well. Thank you so much for watching. Do consider liking, sharing and subscribing to the channel. Thank you.